What symptoms do PTSD and schizophrenia have in common? Have you ever wondered how two seemingly different mental health conditions can share similar symptoms? Today, we will look at post-traumatic stress disorder and schizophrenia to uncover what they have in common. While these two conditions are distinct, they do overlap in several ways, especially when it comes to psychosis and cognitive disruption. One of the most notable shared symptoms is hallucinations. Individuals with either condition may experience auditory hallucinations, where they hear voices or sounds that are not there. In post-traumatic stress disorder, these hallucinations often relate to traumatic memories or figures involved in the trauma. In schizophrenia, the hallucinations can be more varied and are not necessarily linked to trauma. Another common symptom is delusions. Delusions are false beliefs that a person holds firmly, even when evidence contradicts them. In post-traumatic stress disorder, delusions may manifest as paranoia, where individuals feel constantly watched or threatened, often tied to their traumatic experiences. Schizophrenia also features delusions, but they can include a wider range of beliefs, such as grandiose or bizarre ideas. Disorganized thinking is another symptom that appears in both conditions. This can lead to difficulties in organizing thoughts and coherent speech. While disorganized thinking is a hallmark of schizophrenia, it can also occur in post-traumatic stress disorder, particularly when psychosis is present. This symptom can significantly impair communication and social functioning. Negative emotional and cognitive changes are also prevalent in both disorders. Post-traumatic stress disorder often presents with persistent negative thoughts, emotional numbness, and detachment from others. Schizophrenia features negative symptoms like social withdrawal, apathy, and flattened affect, which overlap with the emotional and cognitive symptoms seen in post-traumatic stress disorder. Intrusive memories and flashbacks are key features of post-traumatic stress disorder. However, these can sometimes be so intense that they resemble psychotic symptoms found in schizophrenia. This can blur the lines between the two conditions, especially when post-traumatic stress disorder includes psychotic features. Hyperarousal and agitation are also symptoms that can be seen in both conditions. Post-traumatic stress disorder often leads to hypervigilance, irritability, and sleep disturbances. Schizophrenia may include agitation and heightened arousal, although these are less central symptoms. It is important to note that post-traumatic stress disorder often co-occurs with schizophrenia. The symptoms related to trauma can complicate the clinical picture and may worsen psychotic experiences or mimic aspects of schizophrenia. This comorbidity requires careful assessment to differentiate and treat overlapping symptoms effectively. In summary, post-traumatic stress disorder and schizophrenia share symptoms such as hallucinations, delusions, disorganized thinking, and negative emotional states. While the symptoms of post-traumatic stress disorder are closely tied to trauma, schizophrenia encompasses a broader range of psychotic and negative symptoms. Understanding these overlaps is essential for providing appropriate care for individuals experiencing both conditions.